You may have heard of Kegels before, but pelvic floor therapy can help you get the most out of physical therapy for pelvic pain and urinary symptoms. Let's talk about it today with Rachel Kim, a senior physical therapist at Emerson Hospital. This is HealthWorks Here, the podcast from Emerson Hospital. I'm Prakash Chandran. So, Kim, first of all, what is the pelvic floor and where is it located?
Yeah, so the pelvic floor is a group of muscles. You have both internal and external muscles as part of your pelvic floor. These muscles attach mainly from your pubic bone, which is at the front of your pelvis, to your tailbone or coccyx. These muscles are, acting as support. So the main action of these muscles is to support your inner organs, to support your postural stability and maintain continence so that, you can walk yourself to the bathroom and go to the bathroom. And then that's not just happening.
Right. So, one of the things that we're talking about today is general pelvic health. And this is really the first time that I'm learning about, the pelvic floor and the pelvis. But I did research something called pelvic floor dysfunction. Maybe you can talk about that a little bit.
Yeah. So pelvic floor dysfunction is when something is going on with these muscles and you end up having some symptoms. And pelvic floor dysfunction is a lot more common than many people think. I have some just general statistics to throw out. More than 25 million Americans are suffering from some sort of pelvic floor dysfunction. 80% of that group is women, and most commonly it's urinary incontinence, which is the inability to keep your urine in, resulting in some sort of leaking. To break it down further, this is happening, more so in the pregnant and postpartum population. About, half of pregnant women will suffer from some sort of incontinence, and then this will continue on after the delivery of their children. But it is something that can happen in kind of any age group of individuals. There's some different risk factors for that, kind of including, like I said, that pregnant postpartum group. Also, the postmenopausal group. As women age and estrogen decreases, that puts you at more risk of dysfunction. Any sort of abdominal surgery. This can happen in really high-intensity athletes, individuals that are overweight or obese, or anyone having any other kind of neurological disorders. And I know that we kind of talk a lot about this happening in women, but I do want to mention that pelvic floor dysfunction can also happen in the male population. It's a little bit less common, but it does happen, and is usually in the form of incontinence or pelvic pain.
Okay. And I do want to get back to, how it manifests itself in the male population. But, one thing that I wanted to note is that, we just had a new baby 3 months ago.
Oh,
and,
congratulations.
Thank you very much. But my wife has been surprised because her pelvic floor still seems to be recovering, and she has expressed some of the symptoms that you mentioned, the urinary incontinence and also the constipation. And it's just, it's kind of something that really she didn't expect. So maybe talk a little bit about what kind of symptoms people go through postpartum and what they can expect in terms of a treatment plan and getting themselves better.
Yeah, that's a great question. What we always say is these symptoms are common, as we've discussed, but they're not normal. So anyone that's dealing with these symptoms, our big message, and the reason that we're doing a lot of this education is we want people to know that there is something that they can do about it. It is a treatable condition, and we want to kind of reduce the stigma that's associated with it. So I'm glad that you brought that up. Pelvic physical therapy and intervention is really great, and in more than 60% of individuals, they're getting a resolution of symptoms with it. So some common symptoms that you're going to see, I usually divide it, pelvic health dysfunction into the following categories. So I'm just really going to make this very general, but it's the group of people that can't keep it in. So that's the urinary incontinence. Sometimes some bowel incontinence can happen. Prolapse, where some internal organs are actually descending out. That can happen, especially after childbirth. You're going to feel a lot of pressure and things like that. Then the second category is individuals that can't get it out or are having pain. So that's the constipation, retaining urine, not able to get that urine out, pain with intercourse or internal exams or tampon use or things like that. That's another category. And then kind of that third category is that postpartum prenatal category. So those people that are just having symptoms while they're pregnant or immediately after, that can be a separation of your abdominal wall, which is called a diastasis recti, pubic symphysis separation, which can happen while you're pregnant, where there's some pain and separation in the pelvis. You can also get scar restrictions if there's any trauma during delivery or with cesarean sections, or just kind of pelvic pain. A lot of pregnant women are wearing braces and things like that. So those are all symptoms that are common and things that we can treat in therapy.
Okay, let's talk a little bit about what therapy looks like. So let's say my wife, she is expressing some of the symptoms that you mentioned. She goes for, I guess, pelvic therapy with someone like you. Talk to us what a normal appointment looks like.
Yeah, so what we do is we have the patient come in. Usually they're referred from their physician, and we're really just going to start with a comprehensive history. So we want to know everything that's going on. Is there any medical history? How many children do you have? Kind of take us through those births. We're getting really detailed in everything that's going on. Any other lifestyle factors or history that we need to know about? That's kind of the first line. The second most important thing is that we are usually performing an internal examination. So we really need to look at those pelvic floor muscles, and that's the best way to do it. With that being said, we understand not everyone's comfortable with that, so we can always make adjustments to our evaluation and do more external examination as needed. But we're going to look really closely at what those muscles look like, just like we would on any other part of the body. Is there any scar tissue? Are there any, muscle knots, muscle spasms going on? What is the strength of those muscles? What is the endurance of those muscles? We're looking at the alignment of the pelvis. Are all those bones aligned the way that they should? Flexibility, hip strength, core strength, really comprehensive, detailed evaluation. We might not get to everything on day one, but we're going to look at that through the course of the treatment, and really individualizing our evaluation based on the symptoms. And then our big thing in the beginning is education. Again, this is a foreign subject to a lot of people. They've never even thought about their pelvic floor. So
Right.
We're just really trying to educate people. What can be done? What can we do? And then we move forward from there. And common treatments. If you want me to get into that.
Yeah, I think my wife, she's been going to therapy, and there's a series of exercises that she's doing, after an examination, putting together a schedule of exercises that she should be doing to strengthen her pelvic floor. So maybe talk a little bit about those exercises and any other treatment plans that you might offer.
Yeah, definitely. So just like, we talked about, there's many different categories of pelvic floor dysfunction. There's not going to be a one-size-fits-all treatment approach, but there are many options available. And like I said, we're going to individualize that to each patient. The big things that, are commonly done for treatment are pelvic floor muscle strengthening. We can use biofeedback, which is, using electrodes set up to the pelvic floor muscles that are going to show up on the computer, and then give that patient feedback on what they're doing if they really can't get that muscle control down. Sometimes we need to do some soft tissue mobilization, some scar mobilization, both internally and externally, to help align those muscles better. We might do some strengthening, overall postural and core strengthening, certain behavior modification strategies, things like that. I know you brought up Kegels in the beginning, and I think everyone has heard of Kegels.
Right.
I think that's just kind of a thing that you've heard of. Most people have tried them at some point in their life. They've maybe read a magazine article that says, do your Kegels every day. That is great. We're glad that message is getting out. I just want to say that sometimes, especially those can't keep it in pain diagnoses that I touched upon briefly, sometimes those individuals should not be doing Kegels, and they should actually be avoiding that exercise. So if I just want to caution, if someone starts to do Kegels and they really feel like their symptoms are getting worse or they're not getting better, then that would be kind of an indication to seek out some professional help. Another interesting thing about Kegels is, through research and things like that, we found that 50% of individuals do Kegels wrong just with verbal instruction or written instruction alone. So really just seeing a pelvic therapist and fine-tuning how you're doing that exercise to really get those deep muscles and do them correctly is worthwhile.
Yeah, it really, I mean, the message that I'm taking away from you here is that when you're experiencing some of these symptoms, it's really important to go seek professional help sooner, because it's not a one-size-fits-all solution. You really need to get diagnosed to see where you are in your pelvic floor health journey, and then get the right treatment or exercise plan according to you. Wouldn't you say that's correct?
Exactly, yes.
So, one of the things that I wanted to talk about is, let's say someone listening to this, man or woman, isn't experiencing any problems right now, but they want to be proactive about keeping their pelvic floor healthy and strong. So in the future, they don't run into any of these problems that we're talking about here. Do you have any advice for them?
Yeah, so I think that in those cases where you might be asymptomatic, Kegels are a great preventative exercise to do. So working on trying to strengthen that muscle preventatively is great. It especially helps in the prenatal population. We found that pregnant women that do Kegels are really reducing the chance of having some dysfunction into that postpartum period. So that could go for anyone, just making sure that they're staying strong. Core strengthening is really great. Our abdominal muscles work very closely with our pelvic floor muscles. So if your abdominals are weak, then your pelvic floor muscles are going to have to work harder. So if you're maintaining just a nice exercise program, incorporating some core strengthening into it, that's great. And then just awareness. I think, in some countries, pelvic physical therapy is, part of the treatment plan. As soon as someone has a baby or they have a certain treatment or surgery, they're automatically kind of funneling into that treatment. That, unfortunately, is not the case here. We're hoping to kind of raise more awareness and get that to be the common practice. But kind of being proactive and maybe asking your doctor, should I seek out, these therapies when I'm pregnant or have a baby, or when I'm going through this abdominal surgery or, treatment, should I do this? And kind of asking for that referral or questioning things. I think that's a great message.
And I'm curious as to how effective some of these treatment plans are. We talk about once you make the assessment and you put them on a plan, whether it be exercise or beyond. I'm curious as to if it actually works, or if sometimes maybe something more serious like an interventional surgery might be needed. Maybe talk a little bit about that.
Generally speaking, we have great results. Physical therapy is really the first line of defense for especially like urinary incontinence and diagnoses like that. We're seeing a huge reduction in symptoms. More than 60% find a huge reduction or even a cure with physical therapy alone. But at the same time, we're not always fixing everything. There could be something a little bit more serious going on, or that pain is just not going away. So we work really closely with the referring doctors. We're constantly reassessing, reevaluating, sending that information over to the doctor and really communicating, and then figuring out what the next best plan is. So just kind of that close relationship and constantly reassessing is helpful.
Got it. And, just to wrap up here, I know you've probably seen so many people regarding their pelvic health. I'm curious as to what advice you might have, or something that you wish that people knew before they came to see you.
I think the big message is kind of what I already said, is that these symptoms are common, not normal. We want people to know that they can have a better quality of life. I think you hear it all the time where women are, I can't jump around with my kids, or when I cough, I have to, I might leak some urine, and this is as good as it gets. I had kids. We don't want people to have that attitude. We want them to know that they can, be functioning better, and that it's not scary. Come on in and see us. It's a basic internal exam. We're not using any tools, any speculums, anything like that. And we are really tailoring it to each individual. So we're going to make you feel comfortable. We're going to tailor that exercise program to you. And it's definitely worth a try.
Yeah, that's 100% true. And, I think one of the things that I've learned, especially going through this postpartum experience with my wife, is there really isn't a lot of information. So just talking to you today and understanding that there is a path to normalcy and to strengthening your pelvic floor and eliminating some of these symptoms is just really good to hear. So I really appreciate your time today. That's Rachel Kim, a senior physical therapist at Emerson Hospital. Thanks for checking out this episode of HealthWorks Here. Call to schedule a pelvic floor physical therapy consultation or visit Emerson emersonhospital.org to learn more. If you found this podcast helpful, please share it on your social channels and be sure to check out the entire podcast library for topics of interest to you. Thanks, and we'll talk next time.